Okay, good afternoon, everyone. Is the mic working? Welcome to the new legislative session and our new committee. You will find that both of our committees will be working together at times and going back and forth between each other's meetings in an effort to break down the silos in healthcare. And we are going to be lucky to, as committee chair, about 5 of us, including the money, will be working with Chairman Parrish here again to look at bigger issues. Maybe not all of them solved in one session, but working on even long-term solutions in healthcare. So we have a lot to do. First of all, let me introduce my staff. I think Lynn's probably gone. I know we have Betsy, of course, is our legal representation. Betsy, thank you. I think everybody knows her, members of the committee. She's with Legislative Council. Maggie, stand up. Okay, Maggie is my very smart intern for Georgia Tech. Okay, Georgia boys, don't be offended. So, and my AA, Lynn, stand up. No, there we go, is Lynn. And then my, she's not an intern. She's been with me, what, 3 or 4 years now, Kim? Stand up. 6? Wow, time passes when you're having fun. And this lady right here, who tries to keep us straight and does a real good job of it. So if you need us, you can find one of us, and she does our research. So we have that, and I have a new vice chair, Dale Washman. Dale, wave your hand. Okay, and just to get started, I'll let, for new people in the audience and new people in the committee, let you start here and very briefly, tell us you're a physician, tell us you're a lawyer. Okay.
Michelle Au. I represent House District 50, and I'm a practicing physician in Metro Atlanta.
I'm Mary Margaret Oliver. I represent House District 82, which is in Middle DeKalb, and the entire Emory Healthcare Center is in my district. $10 billion healthcare center.
And Mary Margaret helped spare our behavioral health bill through last time, and we'll be doing more work on that in lots of different ways. Okay, Ms. Bennett.
Good afternoon. I'm Karen Bennett. I represent House District 94, and I hold a Doctor of Physical Therapy degree.
Okay, introduce yourself and what you do and make a living.
Number 1.
Got
Good
it.
afternoon. My name is Carla Drenner. I represent House District 85. I'm a college professor and have 2 doctorates and 2 masters.
So, as they relate to health issues, and in the health bill, in
I have a PhD in occupational safety and health.
health. Thank you. Okay.
I'm sorry. Hi, I'm Representative Devin Seabaugh. I represent District 34 in Cobb County, and I've been in the ambulance business for about 34 years.
Hey, I'm Representative Spencer Fry. I represent Athens, and I'm married to an emergency room nurse.
Okay. I bet she hasn't had any trouble finding a job. Although I begin to wonder, I had about 12 ER physicians in my office just before I ran over here, and I asked them who was looking after the store because they were all from Grady, and I got a little worried in case anybody had an emergency. Okay, Amber, all right, ready to go? Get started again?
That
Okay.
concern was on point, Madam Chairwoman. But I'm State Representative Teddy Reese from Columbus, Georgia, representing House District 140. I'm a practicing attorney, and my wife is a family medicine physician. I don't know how much of that rubs off on me, but I'm proud to represent Piedmont in Columbus, Georgia, that sits solely in my district. And thank you, Chairwoman, for your work.
Thank you.
My name is Carlton Howard. I represent District 129 in Augusta, Georgia. Work real closely with Augusta University, the staff there, and Dr. Keel and the rest of them, along with the Piedmont Hospital as well, and doing community service. Actually, I'm a pastor of a church in Keysville, Georgia, in Burke County. I have family businesses in Augusta, but they're looking forward to working on the committee.
And and he has big steps, big shoes to fill, because he follows in his father's footsteps and his brother. So we're glad to keep the family tradition going.
Thank you.
Welcome.
Thank you, Madam Chair. I am a proud retread of the Healthcare Committee, having previously served. I represent District 48, which is Peachtree Corners, Johns Creek, Alpharetta, and Roswell. My healthcare experience is tied to my 3 young children. I've been to Children's Hospital, and I think my next procedure is free, right?
So many times.
So, yeah.
Well done.
Good afternoon. 27.
27.
Good afternoon. I'm John LaHood. I represent House District 175. That's Valdosta area, South Georgia. I own and operate senior housing and senior living communities.
And I wish that all of our senior housing and our, assisted living facilities were run like John's. We would then not have to worry about any of them in the state, what was happening to our seniors. Gary, you're welcome. It's true. We just need to clone you, let you buy all of them up in the state. Say that.
My name is Barry Fleming, and I represent District 125, which is the suburbs of Augusta, Columbia County, and McDuffie County. Augusta University, the medical college, is building a new hospital in my district. And some of my clients accuse me of being a lawyer, but not all of them.
And as I have to say, years ago, when Republicans took over, we were waiting with bated breath to make sure that he got back in time for to be there for the first day of session, because he was coming back from Russia with a brand new baby boy. And that boy is now in college and looks exactly like his mother. So, and
Thank
doing
goodness.
great. He's a really good student and loves music, and is really a testament to his mom and dad that have raised him right, as we say in the South. Okay, Terry.
I am Terry Anelowitz. I am from House District 42. That is in Cobb County. It includes about half of Smyrna and about half of the Cumberland area, the Battery, Dobbins. And right now I'm mostly with my 2 teenagers, but my professional background includes a lot of healthcare advocacy work, working with patient advocacy groups and alliance development. So a lot of the organizations that we're hearing from, I have worked with in the past.
Thank you. Okay, thank you. When people ask me about what happens and how you get bills passed, it's a lot about relationships. So I hope everybody on the committee will get to know each other. I feel like I have one of the best committees going, and look forward to working with each of you. I think I better call this meeting to official order, and will you pull out of your folders the House Rules Committee for our committee, and take a few moments to read them, and then I will need a motion on what we're going to do with them. Representative Hilton.
Madam Chair, at the appropriate time, I'd like to make a motion to approve.
Well, this is the appropriate time. I'll give you, we'll wait a minute. Okay, I have a motion to approve our rules, and a second on that. I'll give you a few more minutes, and then I'll open it if people have questions or comments on them, any of the members. And I thank you for getting here. I was hoping that setting the quorum at 10 wasn't too high. And so thank you for everybody for coming and coming promptly. So everybody had time to read the rules? Okay, do we have any comments, questions from the committee? And I will welcome Shelley. Shelley, where's your district? 106 in Gwinnett County, and you do for a living?
I'm a clinical social worker, and I have an outpatient mental health center that I've had for over 20 years.
Okay. So we have a wide variety of experience on the committee. Okay. So seeing no questions, everyone in favor of the 2023 and 2024 House rules for the committee, say aye. Anyone opposed, say no. Okay, the ayes have it. That's our main line of business right now. And I will remind anybody that wants to go, years ago, Georgia State applied for a grant from the Woodruff Foundation. And they got it. And they set up and thought that legislators would benefit from a course on looking at healthcare in a more systemic way. And they have been doing that now for several years. That grant, which almost never happens with the Woodruff people, they usually give a grant for one time, and then they don't repeat it. But I think we're on our third time that the course is being offered. They will do that again in the summer, and I would tell you that I think it's very beneficial. But tonight they are having a legislative dinner and discussion. It's from 5:30 to 8:30 at the Commerce Club. So if you did not RSVP, I think there probably would be room for you. And they are discussing behavioral health, our behavioral health system of care, structure, gaps, and opportunities. So you might want to attend if you hadn't, ask Lynn if you need more information by tonight. And with that, I am going to turn it over. I've always said that there were two things in the healthcare system that was going to break the country. One of them is diabetes and all the problems that it causes with the heart disease and strokes and everything else. If you put all those together, and Alzheimer's. And so I asked that for our very first meeting that a group of people that work in all the different areas of Alzheimer's and dementia, if they would make a presentation. So who's going to start it? Come up and introduce yourself, sit at the table, and we'll let you have the floor. And don't be offended if some of our members have to leave at a certain time. There are other meetings and things going on. But we'll get as much as we can from all of us. Introduce yourself as you speak and go ahead and start.
Good afternoon, members of the committee and Madam Chair. Thank you for having us today. My name is Nancy Petra. I'm the Director of Government Affairs for the Alzheimer's Association Georgia chapter, and here today to talk to you a little about the state of Alzheimer's and dementia. Christina, if you want to go ahead and move forward. I'm going to start with some facts and figures from our annual report that reveals the burden of Alzheimer's and dementia on individuals, caregivers, government, and our nation's health system. And you can always go to our website, alls.org, for more information. And just to tell you a little bit about dementia and Alzheimer's. Christine, you can go to the next slide. So the mission of our organization is to end Alzheimer's and all dementia by accelerating global research, driving risk reduction, early detection, and maximizing quality care and support, and working with all of you through advocacy. Go forward. Dementia. Dementia is really an umbrella term like heart disease. That covers a wide range of specific conditions, including Alzheimer's disease. They're called dementia. They're all abnormal brain changes. This is not normal aging. These changes trigger a decline in thinking skills that are severe enough to impair their daily life and independent function. They also affect their behavior, feelings, and relationships. As you can see from this slide, Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which occurs because of microscopic bleeding and blood vessel blockage in the brain, is the second most common cause of dementia. Those who experience brain changes of multiple types of dementia simultaneously have mixed dementia. And the Alzheimer's Association supports trying to end all of these and supports any of these individuals and their caregivers that are living with these diseases. Dementia often starts out slow and gradually gets worse, causes things like wandering and sundowning, and makes it very hard for caregivers to care for them. And so we're here to talk to you about how we can continue to support that. I'll tell you a little bit more about the data that you just saw, Christina. So Alzheimer's, as you saw in the video, kills more people than breast cancer and prostate cancer combined. Next. 1 in 3 seniors will die with Alzheimer's or another dementia. More than 6 million Americans are living with Alzheimer's, and by 2050, the number is expected to rise to nearly 13 million. Alzheimer's, as Madam Chair said, is one of the costliest conditions to our society and our U.S. economy. What do these numbers look like in Georgia specifically for us? For those 65 and older, there were 150,000 people living with Alzheimer's, and we are expecting that to go to at least 190,000 by 2025. That does not count people with other types of dementia or early onset. More than 338,000 Georgians are providing unpaid care for these people living with Alzheimer's and other dementia to keep them in homes in their communities. In 2021, these caregivers provided an estimated 647 million hours of care, valued at nearly $9.3 billion. In 2020, Medicaid costs to Georgia to care for people with Alzheimer's was nearly $1.2 billion. So, that's all the bad news, right? So what's the good news? So, these numbers are staggering. It's a really expensive disease, and left unchecked, it'll destroy finances, families, and our futures. The good news is that here, you and your colleagues here in the General Assembly have been taking action over the years to address this public health crisis. And I want to highlight some of the things that you have worked on to help us with this disease. First off, the state plan, the Georgia Alzheimer's and Related Dementia State Plan. There was a task force, and the plan was adopted in 2013, 2014. We were an early state to follow the national plan to address this difficult disease. And then later they came back and they established the Georgia Alzheimer's and Related Dementia Advisory Council so that we could continue the efforts to make Georgia a dementia-capable state. So it gave more rules around membership of the Advisory Council, terms, meeting requirements, but ultimately it authorizes the council to propose legislative or administrative changes to policies and programs to work with you, basically to further our state plan. Other things, we've taken great strides in this state to protect older, at-risk, vulnerable adults, and most of the time these are people that live with some sort of dementia. So we've had legislation here to prevent elder abuse, neglect, and exploitation. Investigating unlicensed personal care homes, which a lot of them were getting, they were getting placed in and being taken advantage of, and implementing background checks for staff that work in different types of residential facilities and home-based care providers, adding exploitation penalties for benefits trafficking. These cases were on the rise, where older adults were being collected, coerced, isolated, and deceived in order to unlawfully use their public benefits, their Medicare, their Medicaid, their food stamps, and more. So this was benefits trafficking, and we took action to add penalties to our exploitation statutes and crack down on this type of trafficking in Georgia. Next slide. So things that we've done to continue to be dementia capable. So there was an urging resolution in 2018 that was to, it was a House resolution to urge the GARD Advisory Council to review the strengths and weaknesses of the current regulations, as well as assess opportunities to improve access and availability of quality long-term care. GARD was able to develop and work with stakeholders across the state, including legislators, to bring back to the General Assembly recommendations for legislation that's needed to improve access and quality, especially for those with dementia who wander, who wander off from their homes, having memory care centers and places where they could go, where they could be kept safe was really important. So after this urging resolution and stakeholders and legislators all worked together across the state, in 2020, the Senior Care Reform Bill was passed to improve the care provided to people living with Alzheimer's and other dementia in assisted livings and personal care homes. Providers, stakeholders, advocates, and legislators worked hard to create a bill that would increase staff training, including dementia training, improve staffing ratios, require special certifications for memory care centers, and increase fines for those that intentionally harm a resident. We also passed the Georgia Caregivers Act. Alzheimer's joined AARP Georgia to support this legislation last year. We worked closely with the hospital associations to pass legislation to prioritize caregivers in the hospital discharge process when a caregiver was planning to take someone home. You know, those with dementia and Alzheimer's can't always speak for themselves or know how to plan if they now have had a fall and they have a wound or they have some other comorbidity that they have to take care of at home. So we worked closely with the hospital associations here to craft legislation that worked both for them and for the advocates so that we could include them in the discharge planning process and they would be advised and know how to care for these individuals when they would go home and keep them living in the setting that was most appropriate for them. Next. On the funding side, programs and services that have been funded that are helping us to tackle this disease. The Georgia Memory Net was originally funded to give us these memory assessment clinics around the state. And last year there was an increase in the funding for this for these MACs so that we could have more and we could include telehealth services. Yeah.
Tell me more, tell the committee more about what happens at the memory testing sites.
We, Mary Lee's gonna go into that
Okay.
since it's in her purview, but I'm gonna just keep giving you the highlights and then Mary Lee's gonna go into the detail.
Okay.
Okay. You also gave funding for the Think About It campaign, which was through the Department of Public Health, so that we could get out with with media and other resources to get people to be thinking about early diagnosis and awareness of this disease early on, and that campaign still continues. You also funded last year the Dementia Care Specialist Program, which Mary Lee is going to tell you more about, that is now housed within the Division of Aging Services. And over the years, we have put funding into our home and community-based services in the DHS budget so that we can support caregivers who are keeping care of those unpaid caregivers that you heard so much about in the video. The 338,000 caregivers that I mentioned in Georgia, funding so that they can keep their Alzheimer's loved one, whether it's a parent or a spouse at home living in their community. Sometimes they need respite. Sometimes they need home delivered meals. Sometimes they need other personal services. Sometimes they need home modifications. So this is funding that you guys have added to the budget over the years to help us to continue to do that. So, and the GUARD Collaborative is really the roadmap for all that we do here and how we work with you. And so with that, I'm going to turn it over to Mary Lee so she can tell you more about how these initiatives are working in the state.
Do you really talk fast?
All right. Thank you, Nancy. Good afternoon, Madam Chair Cooper and members of the Public Health Committee and Health Committee. Thank you for coming today to learn about the public health crisis known as dementia and the ways that Georgia has invested and strategized to address it. I am Mary Lee Boatwright Quinn, the Assistant Deputy Commissioner of the Division of Aging Services, which is within the Department of Human Services. I come to this role after years of serving as a direct medical social worker in home and community-based settings, and as well as a lobbyist here at the Georgia Capitol for both the Georgia Council on Aging and the Alzheimer's Association. Nancy just shared with you the data that supports the need for Georgia's continued focus on dementia. I am sure you know that the Department of Human Services' vision is stronger families for a stronger Georgia. The Division of Aging Services' vision fits into that by working to create communities where all can live long, live safely, and live well. As the designated state unit on aging, the Division of Aging Services administers the Federal Older Americans Act programs and services, the Medicare Health Insurance Assistance Program, or SHIP, and is the entity providing elder rights and protections through Adult Protective Services, public guardianship, and our forensic special initiatives unit. The Federal Administration on Community Living oversees us and requires us to have a state plan on aging to guide our work. We develop and write our state plan on aging every 4 years with stakeholder and partner input. It is this state plan on aging that sets the goals and activities of our aging network, which consists of our 12 area agencies on aging. We are currently drafting our next state plan on aging that will guide us from 2024 to 2027. I assure you that addressing dementia will be woven throughout our plan. Luckily, as Nancy explained to you, Georgia was an early adopter of a state plan to address dementia, and we use this plan as a roadmap for our work and our collaboration with partners. Here is a chronological history, and Nancy shared a little bit about this. The plan was signed by Governor Deal in 2014 after a couple of years of work with that task force. And then in 2016, the Division of Aging Services funded a coordinator position so that we would have somebody to ensure that the plan doesn't become just something on a shelf that will continue to guide us. And our coordinator is here with us today. Aline Stone is in the committee room. We partnered with GSU's Georgia Health Policy Center in 2019 to do a comprehensive rewrite and reorganization of the plan in order to account for goals that were already accomplished and add new ones to address additional areas of concern, and that resulted in our 2020 state plan. The GARD state plan is intended to be a roadmap for all of us, myself as the division director, you as the General Assembly, and partners like the Alzheimer's Association, Emory, and the Department of Public Health, for example. It helps us to ensure we are working together towards unified goals and we are not duplicating efforts. The roadmap is driving Georgia to become dementia capable. What does dementia capable look like? What does it mean, you ask? It means we as a state ensure broad data collection, research, and analysis, strengthen and bolster the dementia workforce, increase dementia competence across the service delivery network and caregiver network, prepare public safety entities and financial organizations to meet the unique needs of people with dementia, expand outreach and partnerships on facts, risk factors, brain health, and caregiver needs, inform policy actions to improve quality of life, dementia inclusion, and risk reduction, drive early and accurate diagnosis and brain health, and address health disparities.
I don't want to throw you off too much, but okay, we've got a plan and y'all are administering it. Tell us, what that translate into actual care of people and the programs that we have for them, like the one we ask about.
Yep, and that's coming, Madam Chair, I'll speed through this next one. Basically, what I just outlined for you are the broad stroke goals of the GARD state plan and how we get to becoming dementia capable. The GARD collaborative puts those actions into being so that we can meet that goal. And we have GARD work groups in each of those areas that I just listed. So workforce development, service delivery, outreach and partnerships, research and data, public safety, and policy. And we have volunteers who are experts and stakeholders from academia, from government, policy making, healthcare, and those with lived experience to work on those work groups. And I did include a link here because if you have colleagues or you yourself or you have folks in your district that would like to serve on a work group to help us move these actions forward, we would welcome that. And that link will take you to contact information about how to join a work group. So our, as Nancy said, the State Plan Advisory Council was also put in place in 2019. And as she said, it gives the power of GARD to make recommendations towards meeting this goal. So as in OCGA, you will see who is appointed to that advisory council. And that includes members of the health committees, as well as key leaders across the state. So how does that land, as Chair Cooper asked, how does that land in Georgia? How are we addressing it with actual action items? So as Nancy mentioned, we have the Georgia Memory Net program. And because Georgia had the forethought to create a dementia state plan back 10 years ago, we are now a step ahead of the other states in terms of addressing dementia. By creating dementia-specific programming, like the Dementia Care Specialist Program, and creating the infrastructure to diagnose early so that Georgians will be able to take advantage of the first treatments, the Georgia Memory Net program, we have positioned Georgia well to make a big impact. We are also working to establish a collaborative network.
Wait. I'm
Yeah.
looking, and perhaps I didn't make it clear enough. Tell us what they do at the Georgia Memory Net. Now, I don't care about that it's working right now. I've got a mother that has, I don't have one, but that has, I think, dementia. And I'm concerned about it. Tell me what happens, how many you've got around the state, where they are, and
Yeah.
what happens if I take my mother to a Georgia Memory Net center.
Yep. Well, if you will just skip ahead, I will jump to that, to slide number 12, please. All right. So I do want to make sure all of our freshman legislators and members of this committee know about the Georgia Memory Net program. GMN is one of the state's initiatives that addresses the goals in the GUARD State Plan. So the forward thinking of our partners at Emory, who could see that the treatments for the disease that were on the horizon would really need to be administered at the early stages of the disease, helped create this innovative hub and spoke model that other states are trying to replicate. GMN uses the latest diagnostic testing tools and methods to ensure that all Georgians across the state have access to early and accurate diagnosis. If you'll go back one slide with the map, that would be great. The original clinics were located in Atlanta, Albany, Augusta, Columbus, and Macon. The Columbus Clinic is being redeveloped as an outreach and educational hub for primary care physicians, as it is a goal of GMN to strengthen the primary care physician's ability to properly screen their patients when they express cognitive concerns, and especially during the patient's Medicare annual wellness visit. So it's really important that we have our primary care physicians knowing when to assess, and then being able to refer to a memory assessment clinic for that full diagnostic workup. So the way the MAC process works, next slide please. The clients visit their primary care physician for a regular visit or their Medicare annual wellness visit. A client or caregiver can request a mini cog exam, for example, and if potential cognitive concern is detected, then based on the results of that screening, the PCP then refers the patient to the local MAC, and this begins the 2-visit process. So when the client comes for the first visit, there is a state-of-the-art diagnostic needs assessment done, and as well the caregiver needs assessment is completed.
Who pays for that?
Well, Medicare can be billed for these services, and of course the clinics were established through state funding. So that is funded through the Georgia Memory Net program, which the funding is housed in DHS. It started with $4.12 million investment from you all. And as I'm going to talk about, there's $3 million investment that came last year to expand this effort.
And a person doesn't pay anything.
Typically not.
Okay.
They would be covered through their insurance or their Medicare or Medicaid.
Okay.
Correct. So,
Do I have another question on this issue? Okay, Dan.
Thank you, Madam Chair. Just in general, as you're going through your presentation, I don't know if you're going to cover this or not, but the educational components for the general public. I know you talked about usage through practitioners, but what about those people that may not have insurance and can get to a practitioner to access that? And also, do you have hard numbers on the usage of the clinics based on race and income? Particularly in Southwest Georgia, I would be concerned and would like to see the numbers of the usage and how we're reaching individuals in that part of the state.
yes. We definitely have that data, and I can actually get a full kind of, we get annual reports, and we monitor their data monthly at the division. So I can get you a full full data report. I didn't get that far into the weeds today, but I can absolutely get that to the committee.
Okay.
Thank you for
Thank
that
you.
great question. So as I mentioned, in July of 2022, the state awarded GMN with the $3 million expansion funds. So now the program has a total funding of $7.12 million annually. This expansion allows for the opening of 2 new sites, increasing from 5 to 7 locations, and this will allow better access for Georgians in all areas of the state, especially those untouched by a brick and mortar MAC right now.
Is there a reason that they're not up and?
So again, these were the original clinics. These were the original 5 locations, and the good news is that the RFP process is already going with GMN right now. Their application process for the 2 new locations ended in December 31st. And in order to ensure that the next locations address community needs, GMN considered various factors, including the coverage gaps that you see, as well as proximity to an existing MAC, and also the population of Georgians over 65 and where they are living the most. And so this will allow better access for Georgians across the state. As I mentioned earlier, after persistent challenges and careful deliberation, as of May of 2022, the Columbus MAC is no longer operating as a traditional clinic. It will remain involved in primary care outreach activities, and the Division of Aging Services is working closely with GMN to ensure that the original intent of the GMN funds is met and the West Georgia corridor has access to the MAC clinic, to MAC clinic. The other exciting initiative that came really was initiated when we got CARES Act funding at the division. We were able to partner with our Department of Public Health and GMN to get 2 rural telehealth sites up and running in Dooley and Emmanuel County. This partnership is very exciting because we are going to expand it to 24 locations across the state with, again, partnership with local health departments. We are looking at increasing to 12 sites by the end of fiscal year 23 and establish the remaining sites by the end of fiscal year 24.
What do they do with this telehealth coverage?
That means that, you know, for somebody who may have a 2-hour drive, let's say, to a clinic, they could do their second visit in the Department of Public Health through this. There's an office, and we have it all set up with this iPad. We also have a staff member there at the Public Health Department that understands the process. And then they connect with the clinic that way so they don't have to drive further to
So
the
if my
MAC
mother's
location.
primary care physician has thought that she needed to have further diagnostic, I could go to a public health department soon, by the end of 23, in 12 different areas of of the state, and they could do a teleconference to evaluate whether there is early Alzheimer's starting.
Well, actually, it's the primary care physician still needs to make the referral to the MAC.
Right,
We are
that's what I
working
said.
on expanding that and possibly the public health departments, but right now, the partnership is for that second MAC visit.
Okay, after the primary care physician.
Correct.
Right.
Correct. Now, the other piece that we skipped over was the Dementia Care Specialist Program. And Rep. Reese, I think you asked about education of the community. So our Dementia Care Specialist Program is absolutely going to be, there's going to be one in each of the area agencies on aging. They will be kind of the catalyst to pulling together all the dementia resources in that region, and also doing community education in partnership with others that are already doing it and ensuring we're not duplicating those educational efforts. In addition, that Dementia Care Specialist Program will really help us, what we call, when we make a referral from the GMN clinic, we make it from there for community resources to the Area Agency on Aging and the Alzheimer's Association, for example. And now having a dementia care specialist in that AAA, it will really be like a warm handoff to that person and get them really the supportive services they need to address their needs now that they have a diagnosis. Hopefully that answered your question a little bit about addressing community education.
as it relates to potential hacking and HIPAA violations of folks' information and diagnoses being done over the internet. Can you give us some comfort on that? Because I don't know where I stand on that yet. If you could just provide us the newest information.
That was a really, one of the big hurdles, honestly, to get this up and going was ensuring HIPAA privacy, ensuring a network that was safe. But understand that the full workup is still done in person. You know, the state-of-the-art workup and diagnostic is done in person. Not, you know, you're not diagnosing somebody with dementia completely virtually, if that makes sense. So, again, that was an effort to partner with the public health department to reduce the burden for somebody having to get back, because we don't want them to miss the second appointment if they're getting a diagnosis, because it's really critical to get them connected to those home and community-based services at the Area Agency on Aging and our partners at the Alzheimer's Association. Yeah. So I'd be remiss if I didn't tell you just how grateful we are for the partnership with the Department of Public Health. Dr. Toomey has encouraged her team, and we have some great partners there who are also meeting the goals of the GART State Plan in partnership with us. And they were able to get a BOLD grant to really address and create the public health infrastructure to address Alzheimer's disease and other dementias. And so they, you know, take on those, basically it's called the Be Seen Project, which is building our largest dementia infrastructure through systemic education, evidence, and networks. And it's really allowed us to strengthen and make a robust approach to this work in the GARD State Plan. And so I won't go into too much detail with that. If you'll go to the next slide. And
Need
then
to move
I will,
along.
Yep, we're moving it on to Ms. Jill Disney, because really what I wanted to tell you is that this Georgia MemoryNet program and the Dementia Care Specialist program, the combination is allowing us to drive early and accurate diagnosis. And Jill Disney's here to tell you why that's so important, because if folks are not caught at that early stage, then any of the treatments coming down the pipe will not be effective. So, Jill. Say.
Good afternoon. I'm Jill Disney. I am Senior Director of Programs with the Alzheimer's Association Georgia Chapter, and it's my pleasure to add comments to this presentation today. In my role, I work to provide care and support to those who are facing a diagnosis of dementia, their caregivers, the general public, basically anyone concerned about brain health. And we know the impact of this disease is great. The families that we work with, though, are finding a lot of hope in the research that is being done right now and being released. Next slide. Research is an important part of what we do at the Alzheimer's Association, so I just wanted to highlight a little bit about what we're doing here in Georgia. And of the $310 million in research grants that we have awarded that are currently active, there are over $2.5 million that are awarded here in Georgia in grants that are being researched right now. And as we know, supporting the scientific community and sharing information is just as important as doing the research. And we work to foster this sharing by creating a network of those research professionals through our professional organization, iStart, and also in encouraging the researchers to be a part of reviewing grants to ensure that the science is rigorous and really bringing us the answers that we need. And both of those systems are well represented here in Georgia with participation, so we're very proud of that. Next slide. As we see discoveries being made right now, as Mary Lee said, here in the field, it's clear that an early and accurate diagnosis is critical to being able to benefit from the emerging therapies. A lot of the discoveries that are being made are only effective when someone is in the earliest stages of the disease. This really means that it's important that science is backing research to find out how we can find the disease in its earliest stages. We have some accurate ways of detecting now, and folks are accessing that through Georgia MemoryNet and the health systems, but we need more ways that are less invasive and more cost effective. Biomarkers are really the emerging field in early detection and making it more accessible to more people. And they include things like blood tests, that's an emerging biomarker right now, as well as cerebrospinal fluid, and even saliva and retinal imaging. So some pretty innovative things.
It's interesting that you mentioned the biomarkers. I have a bill right now. It may be a pill, but anyway, I have a bill right now in the legislature to, it's a biomarker bill to ensure that the insurance companies will pay for it. To save money and so that people get the right medicine at the right time. It's not only used in Alzheimer's disease, but it's like you go and you were told you have certain cancers, and they can take a blood test and that will tell them which medicine that they should use instead of the old way of them starting you on a medicine, and that medicine then doesn't work, and you've lost 6 weeks or 2 months, you're sick, you've had all the problems that go with it. They can now, because of the biomarker, set you on the right medicine that's available. So we will be looking at that bill, hopefully moving it some committee. I'm not sure. Should have been assigned. That like that. Okay, go ahead. So biomarkers are wonderful.
That's very exciting. And in addition to an early diagnosis, that accurate diagnosis is important. And as personalized medicine becomes more of an applicable, an application in Alzheimer's treatment, we need to know for sure with confirmation that it is an Alzheimer's diagnosis. I wanted to share just kind of a timeline of FDA-approved therapies for Alzheimer's because most people don't realize that some of the drugs that have been prescribed for Alzheimer's, that they're actually not disease-modifying drugs. It wasn't until 2021 that we had our first disease-modifying drug with aducanumab, and that was given accelerated approval from the FDA. And then just this year, we have a second drug. So for many years, the drugs just address symptoms, and they are still being used for that purpose. But we're now seeing drugs that when the diagnosis is made early and it's definitively an Alzheimer's diagnosis, they can potentially slow the cognitive decline in a patient that is administered the drug.
Okay, and these last drugs, the last two, is Medicare paying for them? I know there was a question on the last one, isn't it, that it would cost about $36,000 a year, and there was questions of whether Medicare would pay for it. Has it been approved for Medicare?
It has not been yet. The cost is great, and we are advocating for that cost to be something that is more accessible for folks, including inclusion from CMS.
Okay.
And while some dementia is caused by non-modifiable risk factors, kind of the other part of this, there's the medical part, and then there's the risk reduction through lifestyle factors. Very exciting that up to 40% of dementia cases could be prevented or delayed by targeting modifiable risk factors. 40%. And we're funding a 2-year multi-center randomized clinical trial with 2,000 participants. So this is a 2-year trial. We'll have results very soon. We're including participants age 60 to 79 with a particular focus on making sure that the sample is diverse and we're inclusive of folks from different parts of the country, and looking at folks that are at risk of cognitive decline. If the interventions in physical activity, nutrition, intellectual engagement, and health coaching will lead the way to development of an accessible and sustainable community-based program for prevention. So we're very excited about that as one of our largest initiatives in risk reduction through modifiable risk factors.
I think I just read 3,000 or 4,000 steps a day or something could make the difference in whether you develop Alzheimer's or not. And actually 3,000 or 4,000 steps a day is not a huge amount compared to what they say you ought to do every day or something like. Is that you're studying that kind of thing in the nutrition and
that specific level of detail? So to have those recommendations is what we're hoping to get from the study. Yes, ma'am.
Okay.
And until we know how to prevent or cure Alzheimer's, the association is here in Georgia to provide care and support. So I did want to just mention a few of the things that we do, to provide that care and support to folks across the state. We have a 24/7 helpline where master's level clinicians provide information, referral to local resources, as well as care consultation 24 hours a day. We offer free education, so that community-based education for caregivers to learn effective communication strategies, learn about different stages of the disease and how to care for someone, as well as the healthy living, so that folks can learn how to have healthy brain health throughout their lifetime. We also partner with AARP to provide a community resource finder so that folks can find those local resources, whether they be in an urban area or in a very rural part of our state. So in summary, just wanted to share that this is an exciting time in research, but as this is a tremendous health problem, we know that unless we're really addressing some of the gaps, that it will continue to be a need, and especially as there are treatments and research is advancing, we'll see the gap widen until we address that as well.
Short on time, so let me summarize. Alzheimer's is a terrible disease. It is a major problem in our state and growing with our elderly population. There are new medications on the horizon which may be available if there is early diagnosis, and we're emphasizing early diagnosis for people to be able to get it. And there are more specific things coming so they can actually diagnose if it really is Alzheimer's, and the medication will help. That elder abuse is a real problem, and if you have Alzheimer's or early Alzheimer's, you're more likely to fall, for some kind of elder abuse. And I will tell this committee, it is one of my passions, and it is rampant in this state, that the people that it's not just Georgia taking care of these patients, but that often it's a family member that is a caretaker, and they are under huge stress from this 24 hours of taking care of their loved ones with Alzheimer's, and as it grows worse. The one question I didn't hear, and I think I wasn't specific enough in asking, so I apologize for this, is, and now I've lost it, how much trouble is it, and here back to my mom, which is, would I have to find a bed, and she has Alzheimer's, a unit that will take an Alzheimer's patient? Do we have enough beds in this state and places that will take them and give them protective and adequate care when a loved one can no longer take care of them?
I'm going to pass the mic to Nancy, because my purview
And
is
that needs to be a quick answer so that we can turn it over to the next meeting.
No, we need more. I mean, that's the quick answer. We definitely need more places that can take them, because of the issues that come with caring for someone with dementia. Between the wandering and the behavioral expressions, it is hard always to find people that can take them in. And for our low-income individuals across the state, having more access to the Medicaid waiver program so that they can find places that are affordable. We need more memory care. We need more memory care centers. We need more people that can take them. So that's the quick answer.
Okay, and the difficulty comes, maybe in where they're like an assisted living, or somebody would choose to have an Alzheimer's unit, would be because they do demand more care.
Yes.
They could be as bad as often as they do often become bedridden, but they do wander. We have had them wander out and die. They can have behavioral problems where they act out, become agitated, hard to deal with, combative.
Yes.
Also, they have, what do you call it, sundowners or something, where often it's at night, right? And
Right.
they wander and
They don't sleep.
they
They're up-
don't
yeah.
sleep, and they hallucinate apparently. In it. So this would be some of the factors that would keep some of our places from having
Yes.
memory care units and this kind of thing in
Yes.
places. So we need
Yes.
more beds.
We do.
And more, especially for our lower
Income.
economic, our seniors in a lower economic status like that.
Yes,
Does that get
we
it?
do. Absolutely. Thank you. Yes.
Just a few things. Well, there's an awful lot of people on this committee with white hair, are going white, and if it wasn't for hair color, mine would be white. So we're all hopefully going to live long enough to need to go to one of John's facilities, if we can find one that matches his care in wherever we live. And so I hopefully it will be a major issue that we will consider the care of these people as a high priority. I think a nation is judged on its respect and its care that it gives its elders. And as you know, we say that we respect life, and life is not just for the young and the infants and the young. It's for everybody through the life cycle until death. And I think that we need to be respectful of that and look to those issues. So with that, I will adjourn this part of the meeting and turning it over to my counterpart and for his meeting. Thank you very much. We're adjourned. Thank you, guys.